Alright, today I'll be demonstrating intradermal injections. So when you do injections, you need to remember your rights. So you're going to need your patient's chart. We have our little injection pads as well as the correct syringe. The syringe that I need is a 1 milliliter disposable syringe. Some packages will say directly on the package it is tuberculine or tuberculose syringe, but it is a 1 milliliter Luerlock tip with a 27 gauge 1/2 inch needle. So that is the correct size. I need to make sure that I have the correct patient, so I'm going to go ahead and check my MAR to make sure that I have the right patient, the right drug, right dose, right medication, route, time, everything. So I'm checked to make sure I have tuberculine solution that is due. I'm going to then take my patient's chart with me to my patient. Let's knock on the door, introduce and perform AIDIT. So Mr. Smith, my name is Erin. I'm going to be your nursing student today. I'm going to be giving you your TB test or your tuberculine or tuberculosis test, which goes in your forearm. It takes about 5 minutes or so. You'll feel just a little bit of discomfort with just the needle stick. That is all. Can you tell me your name and your birthday? They'll tell you your name and birthday. Make sure you check your date, your wristband, and confirm. All right, thank you, Mr. Smith. So I've done my second check with the patient and the MAR. I'm going to then again perform my third check. I've made sure I've got the right syringe, right medication, and everything ready to go. So I'm going to wash my hands, put on procedure gloves, or just clean gloves. This is not a sterile procedure. You need to position your patient in the appropriate place, so bed waist height, and you need to maybe have their arm just resting either on a pillow or the best position for you, because we're going to use our forearm. So I'm going to then go ahead and take an alcohol swab and clean the top of my vial. I'm going to go ahead and open my syringe. When I uncap, always pull away from me. And I'm going to check with my MAR. So it says tuberculine solution 0.1. I'm going to check my vial. Tuberculine solution 0.1 is my dose. So I'm going to pull back air to that dose. Make sure my top is still clean. I'm going to inject air. And then I'm going to draw up my solution. Just a little bit past. I have a pretty decent sized air bubble. So I'm going to inject that back, pull it out, tap to make sure I have no air bubbles and it's the correct dose. Again, checking my MAR, make sure it's the correct dose. And in order to recap, when you recap your needles, you're going to just scoop and then click. I'm going to make sure that this is still tight and everything. And then I'm going to take my medication to my patient and perform the administration. So when I get ready to insert everything, I'm going to clean my patient's skin, starting as a circle and going out, letting the skin dry. Don't wave over it or blow on it. That's just going to put germs back on the skin and compromise your patient for infection. Once the skin is dry, again, I'm going to uncap my needle. I'm going to then take the needle with the bevel up, so you'll see the little slant, or you'll see the opening of the needle. I'm going to hold my needle like a dart. I'm going to hold the skin tight. And when I do my intradermal injection, you're going in at a 5-degree angle. So you're just going to skim right along your patient's skin, right underneath. And you're going to inject and pull out. And you're going to activate your safety. In this case, the syringe doesn't have a safety, so I'm going to go ahead and recap. What you are looking for on your patient is a wheal or a bubble. Our low fat pads don't hold the bubbles anymore. And then what you're going to do is you're going to just blot gently with a piece of gauze any blood, and then you're not going to put any band-aids or anything over the top, as that could compromise the testing solution itself. You're going to then document the date, time, and location on your card as well as your MAR, because your patient will need to bring that card back in 48 to 72 hours to get their TB test red to make sure that it was either negative or positive. And make sure you let your patient know that, all right, Mr. Smith, I'm done with the injection. Please remember to come back in 48 to 72 hours to make sure that we get our test read to see what our results say. And that's it.